Mark Halatke and the SPARC investigators recently published their economic analysis, and my guest today wrote the invited editorial that accompanies the SPARC economic analysis. We're talking about the paper comparing outcomes and costs following cardiovascular imaging, a SPARC, but further illumination is needed. I am with the author of that, Todd C. Villines, who is MD, Director of Cardiovascular Research, co-director of the Cardiac CT program, and that's at Walter Reed National Military Medical Center. To begin with, remind us what the SPARC registry is.
Well, the SPARC registry is a very important study that involves patients from more than 40 centers, mainly in the United States, in the very early years of cardiac CT. And the goal of the SPARC registry was to enroll patients, real-world patients, who were referred for 3 different forms of non-invasive imaging. Either coronary CT angiography using 64-slice scanners, which at that time, when the registry was started in 2006, was a brand new technology. The other was PET, perfusion imaging, which at that time was also very novel, versus what was a well-proven imaging technique, and that is SPECT, myocardial perfusion imaging.
So what did they find?
They followed these patients and essentially found, there's a little over 1,500 patients, they found that the current paper was looking at cost. They had previously reported the outcomes regarding use of medications and use of coronary angiography, but they had not yet published a cost, and all of us in the imaging world are very interested in cost. And what they found when they compared these 3 imaging modalities was that in aggregate there were slightly higher costs related to coronary CT angiography and PET scanning as compared to the standard being SPECT imaging.
Now, when you're trying to determine whether a patient has CAD, there are so many different factors that go into your choice of imaging. What can this paper actually tell us?
Well, I think this is a first start, but I think it's important to really appreciate the significant limitations of this analysis. First and foremost, as I mentioned, this was an analysis done in the very early years of coronary CT. These patients were not, this is not a randomized controlled trial, this is a registry. These patients were referred to these tests for very different reasons, and in fact, when you look at the subgroups of patients, they were extremely different patients. For example, people referred to coronary CT, about a third of them had already undergone ischemic testing of some type, and compared to SPECT, very few, in fact less than 5% of patients had undergone ischemic testing. And so I think we have to appreciate the results in the context of the trial, or the context of the study, and realize that these were very different populations that were studied. And also to appreciate that this is very early in the years of coronary CT angiography. So the authors also attempted to do a cost-effectiveness analysis based on mortality rates. And when you look at that data, it was very favorable actually for coronary CT from a cost-effectiveness analysis, in the sense that there were significantly lower myocardial infarctions and overall deaths in the CT arm at the cost of a slightly higher rate of coronary revascularizations and invasive coronary angiography.
So what's the bottom line message in terms of how to save money with imaging?
Well, I think we just need more data. I think this is a first start. We looked at this and we're really anxiously awaiting this data, but I think we were missing a lot of important covariables. For example, renal function was not reported. We know that that was probably very different between these patients. People with good kidneys probably got sent to angiography more likely. They were more likely to get coronary CT angiography. We just don't have that data. And we really don't know who was right. When we looked at coronary CT angiography, more people got revascularized. Maybe that was more appropriate. We don't know. And so we need to look at not just overall cost, but cost effectiveness. And I think for the coronary CT angiographers, this was a very reassuring study that the trends in cost effectiveness were trending towards favoring coronary CT angiography. But we just need more data.
So this is the SPARC's analysis. This is their economics analysis. It is in the March 18th issue of JACC, as well as the commentary by Dr. Villines. For CardioSource World News, I'm Executive Editor Rick McGuire.